How can you treat anal fissures at home? Watch this video. At-home treatments are often the first step in treating anal fissures. Other treatments might include medications which are prescribed by a trained physician and sometimes surgery. But in general, these home treatments can be done by an individual patient either around the time of surgery or in addition to prescribed medications that I just mentioned. In previous videos, we talked about the reason an anal fissure happens and why it hurts so much. At the end of this video, there will be a link to a playlist for those videos talking about anal fissures and other videos about treatments for anal fissures. Typically, anal fissures are caused by trauma to the anal canal, or at least start that way. This repetitive trauma leads to, guess what? Even more trauma. Pain leads to spasm, spasm leads to pain, and so forth, as shown in this diagram. Again, we explain this diagram in another video. So one treatment strategy is obviously to stop the trauma. And you can do that by doing several different things at home. For example, increasing your fiber intake. And you can increase your fiber intake by either taking a fiber supplement or by just eating fruits and vegetables. The goal is to get your fiber up to about 30 grams per day. In addition to this, you want to add lots of fluids by mouth. You want to take about 1.5 liters to 2 liters of fluid a day. And in general, that can be done by drinking the bottles of water that you might find, for example. Each of those is about 1/2 liter, so 3 or 4 of those over a day should get you there. In addition to a high fiber diet with lots of fluids, over-the-counter medications can help. For example, a stool softener like Colace. In general, we recommend, or at least my office recommends, 1 tablet twice a day. In addition to that, if you're a little on the constipated side, which again can cause trauma, a laxative can be in order. You can use anything from bisacodyl tablets over the counter or something very gentle like milk of magnesia. The goal is to have about 1 soft bowel movement a day with this regimen. Over-the-counter drugs such as acetaminophen or ibuprofen can help with the pain and also helps with the inflammatory component of anal fissures. Using these for a short course, for example, over about 5 days, can help with the pain and again break that vicious circle we talked about earlier. Now let's briefly summarize these home treatments. Home treatments can include a high fiber diet, copious fluids by mouth, anti-inflammatory medications like acetaminophen and ibuprofen, then also things like stool softeners and laxatives. This whole treatment is designed at increasing blood flow and helping tissues to heal. At the end of the video, it'll be summarized in the form of tables, diagrams, and other information. And again, at the end of the video, please find links to other videos on anal fissures. Thank you.